Most people think the biggest risk of surgery is whether they'll wake up. But for many adults over 70, the real question isn't if you wake up, it's how you wake up. Will you recognize your family? Will you remember yesterday's conversations? Will you still feel like yourself? The surprising truth is that one simple conversation before surgery may help lower the risk of these problems, yet almost nobody knows to have it. A few years ago, an elderly gentleman, we'll call him Richard, went into the hospital for what everyone believed was a routine operation. His children were understandably nervous, but the surgeon reassured them that everything had gone perfectly. The procedure was successful, and there were no complications during surgery. Everyone expected a smooth recovery. Hours later, Richard opened his eyes. Physically, he was stable, and the operation had been a success. But when his daughter smiled, held his hand, and welcomed him back, he stared at her with confusion. Then he quietly whispered, "Who are you?" At first, she laughed, assuming he was simply groggy from the anesthesia. But the confusion didn't disappear. Richard couldn't remember why he was in the hospital. He believed he was living in a house he had sold more than 20 years earlier. The surgery had repaired his body, yet his family suddenly became worried about something far more precious: his memory, his thinking, and the man they knew. After spending decades working alongside surgical teams and caring for older adults before and after operations, one lesson becomes impossible to ignore. For seniors, preparing for surgery isn't only about choosing the right surgeon. It's also about protecting the brain. That part of preparation is often overlooked, but it may be just as important as the procedure itself. Modern anesthesia has made surgery dramatically safer than it was decades ago. Millions of people undergo operations every year without serious problems. However, aging changes how the body, and especially the brain, responds to medications. Understanding that difference can completely change the conversation you have before entering the operating room. Think of the brain like a busy airport. Every second, millions of signals arrive and depart. These signals control memory, attention, balance, and decision-making. General anesthesia temporarily slows much of this activity, so surgery can happen safely. For younger adults, the brain usually returns to normal quickly after the procedure. As we age, recovery isn't always as fast. Blood flow changes, medications stay in the body longer, and inflammation after surgery may last longer than expected. Instead of immediately reconnecting all those important pathways, the brain sometimes needs extra time. That's why some older adults experience temporary confusion after surgery. Now let's be clear. This doesn't mean anesthesia is dangerous for everyone. Millions of older adults recover beautifully after surgery, and in many cases, general anesthesia is absolutely the safest choice. The goal isn't to avoid necessary treatment. The goal is making sure the anesthesia plan matches the individual patient, and that conversation truly matters. The first important question is whether your brain risk has been evaluated. Many people ask about heart risks before surgery, but very few ask about brain health. Yet age, memory problems, previous strokes, sleep disorders, hearing loss, and certain medications can all influence how the brain recovers afterward. Studies suggest that older adults with several of these risk factors are more likely to experience temporary confusion after surgery. Imagine two patients of the same age. One receives a detailed cognitive assessment before surgery, while the other follows a standard plan. Small adjustments in care may make a meaningful difference in recovery. The second step is reviewing your medications. Many seniors take 5, 8, or even 10 medicines every day. Sleeping pills, anxiety medications, strong pain relievers, bladder medications, and even some allergy medicines may interact differently with anesthesia. Together, these combinations can increase the risk of excessive sedation or confusion afterward. Researchers estimate that medication interactions contribute to many preventable hospital complications in older adults. In one case, a pharmacist discovered that an elderly patient's nighttime medication could be adjusted temporarily before surgery. That simple change helped reduce postoperative grogginess. Always bring a complete medication list, including vitamins, herbal supplements, eye drops, and every prescription you use. The third step is protecting your brain with better sleep before surgery. Many patients barely sleep the night before because they're anxious, fasting, or worried about what lies ahead. But poor sleep doesn't just make you feel tired. It can leave the brain more vulnerable to confusion during recovery. Sleep is when the brain organizes memories and clears away waste products. Missing that important recovery time may reduce mental resilience during the stress of surgery. Instead of spending the night scrolling through your phone, consider calming music, deep breathing, or reading something relaxing. One good night's sleep may be more valuable than many people realize. The fourth step is staying properly hydrated. Many older adults arrive for surgery slightly dehydrated, either because they've been fasting or because they already drink very little water. Dehydration can affect blood pressure, kidney function, medication clearance, and even brain performance during recovery. Hospital teams carefully manage fluids during surgery, but arriving well hydrated, while still following your doctor's fasting instructions, is an important part of preparation. One older woman admitted she avoided drinking water because she didn't want frequent bathroom trips. After discussing her routine with her medical team, she recovered much more comfortably. The fifth step is planning your recovery before surgery even begins. Many families spend weeks preparing for the operation itself, but very few prepare for what happens afterward. Who will stay with the patient? Who will organize medications? And who will notice if confusion begins to develop? Early recognition can make a real difference. Simple measures like better lighting, wearing hearing aids, using eyeglasses, and having familiar family members nearby help many patients stay oriented. Hospitals increasingly encourage these supportive strategies because they may reduce delirium in vulnerable older adults. Recovery truly begins before the operation starts. Before your next operation, bring 5 important questions to your consultation. Ask whether you're at higher risk for postoperative delirium, whether different anesthesia options are appropriate, whether any medications should be adjusted, how pain will be managed afterward, and what your family can do to support your recovery. These questions don't challenge your medical team. They strengthen the conversation. Good doctors appreciate informed patients. The encouraging news is that medicine continues to improve with better monitoring technology, safer medications, more personalized dosing, and greater awareness of protecting cognitive health in older adults than ever before. Margaret was 79 when she needed hip surgery. She arrived prepared with an updated medication list, and her daughter attended every consultation. Together, they discussed anesthesia options in advance. After surgery, Margaret immediately wore her glasses and hearing aids while her family kept conversations calm and familiar. Within days, Margaret was walking with physical therapy. Within weeks, she was back tending the flowers she loved. Her daughter later said, "We prepared for her body, but I'm grateful we also prepared for her mind." A successful surgery doesn't only repair the body, it protects the person you are. Today we learned that brain health deserves attention before surgery. Medication reviews can reduce unnecessary risks. Sleep and hydration influence recovery, and family preparation is an important part of medical care. Asking informed questions may lead to a more personalized treatment plan and a smoother recovery. Small conversations today can make a very big difference tomorrow. If this video helped you think differently about surgery, share it with a parent, grandparent, or friend over 70. Subscribe for more evidence-based videos on healthy aging, memory protection, and safer medical decisions. And remember, this video is for educational purposes only. Always discuss your personal medical history, medications, anesthesia options, and treatment decisions with your healthcare provider before surgery.